Hi, my name is Mark Shulman. I'm a physical therapist and the owner of the Physical Therapy Effect in San Diego. We have two locations, one serving downtown San Diego in Little Italy neighborhood, and the other one is serving the North County of San Diego, operating out of San Marcos. I'm here today with one of our physical therapists, Bree Moore. She is one of our pelvic health specialists, and so we're going to go over a few things that we asked ChatGPT to tell us about the pelvic floor. These were some of the top questions that ChatGPT gave back to us, so we're going to go over that today. Sound good, Bree?
Sounds great.
Okay. So the first question that we're going to talk about is what exactly is pelvic floor therapy and why is it important?
So when we're talking about the pelvic floor, it is a group of muscles that exists at the bottom of your pelvis. So it has a ton of functions in your body. It's really important for breathing mechanics. It is a part of your core, so it's really important for postural stability, pelvic support. It has a huge function in continence. It has a sexual function. It has a really important role for moving fluids in and around your pelvis. And so when there is dysfunction at your pelvic floor, it can lead to a long list of symptoms, and it can also be affecting other parts of your body where you might be having symptoms.
Okay, so you listed a lot of different things there. One of the things I think was interesting is how it affects maybe breathing. We've heard a lot about, or there's a lot of content out there about how the pelvic floor and leakage, or how it may interrupt sex or anything else along those lines. But let's talk about breathing as one of the potential affected areas.
Yeah, so the pelvic floor, with its shape, kind of functions like a trampoline. So when we take a big breath in, we have air that is displaced in our body, it takes up space, and our pelvic floor kind of acts like a trampoline to help move our organs and allow space for them to move down so that we can fill our air or our lungs with air. As we are breathing and moving and changing positions, lifting, doing anything that is effortful, we create a lot of pressure in our abdominal cavity, and our pelvic floor is really important for supporting that pressure and keeping all of our organs supported during those movements.
Cool. So a trampoline, how much bounce do we want?
So I think we hear a lot about pelvic floor strength, and we want the muscles to be really strong, but we also need them to be flexible. We need them to have really good range of motion, and we also want to be really good at relaxing them so that we can empty our bladder, so that we can have a comfortable bowel movement. Having the ability to lengthen and relax those muscles is also really important for our sexual function.
Cool. Okay, I think that's a pretty good answer. So if I was to come in for an initial evaluation, or any patient was to come in for an initial evaluation for physical therapy for the pelvic health specifically, what does that typically entail?
So most of the first visit is going to be a lot of talking. So I have a long list of questions that I ask people, trying to chase down all of their symptoms. Most people coming in for pelvic floor physical therapy have a story to tell. Their symptoms have often been happening for a long period of time. So we go through all of their concerns. We talk about the history of their symptoms. I ask questions in categories of urinary, bowel, sexual function, and then a uterine history for women. The assessment, how we look at you moving, we look at walking, changing position, we look at your low back range of motion, your hip range of motion, strength, and kind of anywhere that we need to go from there. But most of the first session, lots of talking.
Sounds good. That sounds like a lot of stuff. It sounds really intense. How is it that you kind of determine what needs to be looked at versus something that is not necessary at the time?
It can be a little bit of triage, depending on how many things are contributing and how long the symptoms have been going on. I think that's where working with someone who has a lot of experience in pelvic health can be really valuable, because they're going to be a little bit better at determining all of the things that might be contributing to that. But we tend to be kind of zoomed in on the pelvic floor on the first day. And then in the next few appointments, we can kind of zoom out to other areas of the body.
Cool. So you also mentioned that a lot of these symptoms tend to be going on for quite some time. On average, how long do you think most people have these symptoms before they actually seek care?
So some people have tried to seek care. So they've gone into their OBGYN, to their primary care physician, and a lot of times they were not given great resources or not told about pelvic PT existing. So from what I see of people coming into the clinic, anywhere from a month or two, their symptoms could have existed all the way up to 10, 15, 20 years.
Okay. And you also mentioned all of those things that you look at on a given day. Is there any time that you start an internal examination within the first visit?
It really depends on how much time we spend on kind of talking about the symptoms. Sometimes a patient has a lot of symptoms to report and a lot of questions and a lot of things to address first. I often do an internal assessment on the first day if the patient feels comfortable with it. We talk about what it entails and if they would like to proceed. An internal assessment can be really beneficial to get more objective information about the pelvic floor, but it is completely optional based on how comfortable the patient feels with it.
That sounds about right. Yeah, I mean, I would assume that, is it about 50-50 the number of people who say yes to the exam versus, is it more people say yes, more people say no? What's kind of...
Yeah, I would say significantly more people opt for the internal assessment. It can be a really important piece of the puzzle when we're trying to determine a plan of care. Some interventions are opposite of each other. If we need to focus on down training or working on range of motion versus up training and strengthening, we want to confirm which direction we want to go, and the internal assessment allows us to do that. I think once most people have come into the clinic and they understand the value of the internal assessment, they feel comfortable moving forward. There can be a lot of barriers to starting it. Sometimes that's pain. Sometimes that is just not feeling comfortable on your first day doing it. And all of those things we kind of factor into when we do it.
That sounds good. So you mentioned different treatments and different things like that, up training versus down training. What kind of treatments do you typically use to help you treat the pelvic floor?
Anything and everything. So it's most often a combination of hands-on treatments. So sometimes muscle releases, biofeedback, stretching, learning to connect with your body. So being able to contract and relax your pelvic floor. We also instruct exercise that we do in the clinic together. And that's usually a big piece of homework, is exercises that patients work on at home. And then a really large piece of treatment are going to be lifestyle changes. And that can be anything from how much water you're drinking and the pace in which you drink that throughout the day. Are you including fiber in your diet? We talk about urge suppression techniques, mindfulness. And so sometimes your homework is not going to be an exercise, but more of a strategy for how you move or how you interact with everything in your life.
Okay, so you wanted to change everything about this, basically.
Sometimes we start small, and sometimes there's a long list of things that we need to address.
That's fair. Typically, how many exercises or how many activities would you typically give somebody on the first session?
Probably 1 to 3 pieces of homework for that week. Sometimes it's just doing an inventory or a little bit of a diary of your urinary habits or your bowel habits. Sometimes it's the first time patients have been asked those questions. It's the first time that they've kind of tuned into what they're doing throughout the day. So oftentimes we need a little bit more information in that first week away. But I think it depends as well. Some people are looking for a lot of things to change, and they like the homework piece. They like to have a lot of exercises, and sometimes with busy careers and busy lives and kids and all of those things. They're like, I have 5 minutes a day to dedicate to that. So we really try to whittle it down to the most important things first.
That sounds like a good idea. I mean, I would assume that just like in orthopedics, we're looking for the most effective tool, right, to treat whatever is going on with that particular patient.
Yeah, the biggest bang for our buck first.
Okay, that sounds reasonable, and I think it's a good idea too when we look at it from a standpoint of the patient side. Like, hey, the easier we make it, the more likely they are to be compliant with it.
100%. And I think we do a really good job of trying to tailor things to people as individuals. If I give someone a home program that doesn't function for their life, it doesn't matter how good the advice is, it's not going to work for them. And so I want to make sure that it's something that is targeting their concerns, but really valuable and possible for them to incorporate.
That's awesome. So in all of this, what if somebody feels like they need to bring somebody with them for a little bit of support, or they just want to have somebody else in the room?
Yeah, 100%. So a chaperone is always a possibility. You can bring your own support person, someone that you feel comfortable with, or often there are multiple therapists or multiple people in the clinic. So if you'd feel more comfortable with us providing a person, we can absolutely do that too.
Okay, that sounds good. How did you end up getting into pelvic health physical therapy?
Great question. So I don't think I ever saw myself in this space when I was in PT school. I started practicing as an orthopedic therapist in a sports medicine clinic. And my enlightenment about the pelvic floor came from my female low back pain and hip pain patients, that I felt like I was getting 80% better, but there was a missing piece. There was something that I was not addressing that was not getting them all the way to their goals. Luckily, I had friends and colleagues and mentors who worked in the pelvic health space. So as I learned more about it and I started incorporating it in my practice, I noticed that my patients were getting all the way better and I was making a lot more progress with them. And then I started incorporating more of those practices, and kind of just, it kept taking over my practice, and now I love working with these patients. It is my favorite thing to treat.
Interesting. All right, well, that's pretty cool. So I think this is a good place for us to stop today. But if you do have any questions, like I said, we're at the Physical Therapy Effect. We have 2 locations, one in downtown San Diego in Little Italy. We have the other one in San Marcos, treating our North County patients. You can always give us a call at 619-544-1055 or shoot us an email at info@PTEffect. Have a great day.